different people, it seems that the term has often been misunderstood as to what it really encompasses. So I'm going to start off with the presentation by discussing what really it is. And here's just a little clue, so, a little graphic. So who provided it, why is it necessary, and etc. So first, sometimes there's a term aural rehabilitation. Aural, A-U-R-A-L, means ears. So it's rehabilitating ears, but um, it's sometimes synonymously changed with the term auditory rehabilitation. Now, speech language pathologists prefer to use the term aural rehabilitation. Audiologists recently have preferred to use the term auditory rehabilitation, and it's actually a strategic reason for doing that, which I won't go into. So even before we talk about rehabilitation, I think we need to differentiate between habilitation versus rehabilitation so that you can better understand what rehabilitation is. It's good to contrast it. So habilitation refers to effort when we're trying to help a child acquire new skills that are related to daily living activities. So, for example, children who are born with hearing loss. So, congenital hearing loss, congenital means like born with. It involves working with a child to acquire language. So, they don't have language, so we have to help them develop something. So, by habilitation, we're helping them acquire the skill of language, which they need in part of their daily living. Now, depending on the approach used, it may include auditory skills in spoken language, especially if the parents are hearing. But there are children who are born of deaf parents, and or they're born of hearing parents who want their children also exposed to American Sign Language. So it may be one way spoken, it may also be sign language. Rehabilitation, on the other hand, involves assisting someone who has had a skill, but for whatever reason lost that ability and has to reacquire it. So rehabilitation to reacquire a particular skill. So for example, if someone had a stroke, it may be like working on if they've lost the ability to perhaps walk on one side. So the idea is to help them be able to again walk in their life as effectively as possible. Or if they had a stroke that affected their speech, helping them to acquire their communication abilities, such as what happened to Gabby Gifford when she was shot. She lost the ability to speak and became what's called aphasia, motor aphasia. And so she worked for a speech and language pathologist. She's never gotten back the fluency that she did have, but through speech and language pathology, she was able, and she is able, to communicate somewhat nowadays, and I've seen her interviewed, etc. So, so someone with acquired hearing loss, when we're talking about someone who had good hearing and they develop hearing loss, then we want to restore as much as possible their auditory ability and their communication as much as possible so that they can live as independently and enjoy sound to the best effects or to their potential that they can. So perception, okay, the components of what constitutes our rehabilitation varied within the audiology profession and across different professions. So when you look at the literature, there's multiple definitions of it. Now, some of the definitions will stress activities that focus on addressing the hearing loss specifically. So, or rehabilitation, they may say, oh, it's the fitting of hearing aid or testing a person's hearing and fitting hearing aid. And the goal is to address the physical impairment or physical impairment in this case being the hearing loss. How can we help the person hear better? So that's one definition. Others, their focus is somewhat different. It's not just to fit hearing aid, but to reduce the communication difficulties because there are many individuals, even if you put hearing aid, they can't benefit from it. Or if they get cochlear implants, if they become very, very deaf, they still have communication difficulties, even with a device. So how can we help them in everyday life to communicate as effectively as possible? So that's a different focus. So as you'll see as I continue the presentation, when you have a comprehensive oral rehab approach, individuals tend to combine both to either fit hearing aids or devices, as well as then subsequently try to work on reducing the issue that impact effective communication in everyday life. So most audiologists appear to view oral rehab activities as being exclusive. So we're talking about just audiologists themselves. So they see oral rehab as a specialty area. And it does not, so oral rehab does not include diagnostic audiology and hearing aid. It's something different, very specifically that they may not even engage in. So as a result, oral rehab is often thought of being restricted by audiologists to specific services, such as auditory training and speech reading. So that is a specific area that many audiologists think what oral rehab is. Now, one thing you may not know is under the old Medicare law of 1965, they classified all these different health professionals, and in classifying audiologists, they come under the category called diagnosticians. So they are not reimbursed for doing any type of rehabilitation by Medicare or by health insurance. Health insurance follow the Medicare guidelines. Medicare does not consider audiologists as rehabilitationists. Therefore, if an audiologist was to do rehabilitation like auditory training and speech reading and try to bill for it, Medicare and healthcare or health insurance will not reimburse the audiologist for the time. So only those professionals that are classified as either habilitationists or rehabilitationists, such as speech and language pathologists, physical therapists, or psychologists, only they can be reimbursed by health insurance for rehabilitation activities. So consequently, because audiologists can't get reimbursed for this, a great majority do not incorporate these what they think are the specific AR activities, such as auditory training and speech reading, unless they were to do it privately. But the great majority of people don't want to pay for private services, so you end up they're not doing that very much. Now, in 1992, the American Speech Language and Hearing Association, known as ASHA, is one of the two major national organizations which audiologists and speech language pathologists, well, audiologists belong to. And they have different special interest groups. So they defined remember I said AR can also stand for audiologic rehabilitation. So they use that term. Audiology, audiologic rehabilitation is audiology. That is, the entire field of audiology is designed to be rehabilitative in nature. So this definition doesn't exclude auditory training and speech reading in a specific area. They're also saying also that even getting a hearing test, the fitting of hearing aids or assistive devices, that is also part of oral rehabilitation or auditory rehabilitation. So this definition, they developed that definition to help audiologists understand the focus is you want to look at the importance of the impact of the hearing loss on how one functions in everyday life. Not only looking at the individual, but you want to see how they engage with their family, how their family is affected, and how does that individual interact with their daily environment. So we want to look at the holistically the person who has the hearing loss and how we can best help them. So therefore, if someone asks you what is oral rehabilitation, basically now audiology students and other audiologists have come to understand It's anything to basically remediate or mitigate the effects of hearing loss, but it does not include medical services. Can someone get muted there? Okay. So it includes anything that remediates the effect of hearing loss, but it does not include medical services. That is under the domain of ear, nose, and throat doctors. And it does not include educational services like schools that provide special education services for individuals with hearing loss. Anything else is oral rehabilitation. So it's very broad in perspective. It's anything related to audiology that's not medical or specifically educational. So here is a little graphic that I'll go into more detail over time that was developed and it's shown from 2011 and it came from an article. And so the heart of oral or auditory rehabilitation is the counseling aspect. That is, counseling in this case has many aspects, but it basically means working with a client or an individual and focused on that client. And we'll get into different components, but one is such as the patient story. Why are they coming to get services? Then you have the patient or the client do a self-assessment. We give questionnaires, and I'm going to go into more detail. They'll get questionnaires that they have to respond as to in different listening environments, where do they struggle the most and have difficulty. Then we do a hearing test. And then after the hearing test and knowing what the degree of hearing loss is, we know what the difficulties are. We then might recommend different communication strategies, technology that may include hearing aid or assistive devices, talk about auditory visual training or speech reading. And then after go being taught the strategies and getting the devices to verify how much you're benefiting from it, and always at the heart of it, providing consumer report. So again, this slide indicates a person-focused approach to addressing the needs of someone with hearing loss. Now, but the problem was, even as of 2008, in an article in Kochkin in 2009, they found that less than 20% of new hearing aid users and less than 10% of experienced users got anything beyond the use of hearing aid. That means they had the hearing test, they got the hearing aid, and then nothing else really. So the audiologists were basically focusing, the great majority of them, just focusing on the hearing testing and fitting a hearing aid. And again, this exclusive area that they thought oral rehab, that was not part of their role. Also, new users were only getting less than, on average, less than 30 minutes of counseling or guidance. And there's so much to know in this field. Like just by today, you're going to get an hour in some way of counseling because I'm presenting on this topic. And that's more than you would typically get from many, many audiologists, probably even nowadays. And less than 5% of the patients who left it or are leaving an audiology clinic actually were provided with the opportunity to actually do some formal rehabilitation training. So even though 1992, there was the definition, the guidance, most audiologists were not providing these type of services. Now, for a certain percentage of individuals who just get hearing aid, just getting a hearing aid sufficient. They're fit with the hearing aid, they get the hearing aid adjusted, and for a certain percentage, that's enough to do very well in everyday life. But for a significant portion of those individuals, that's not enough. They need other services to help them, especially those with more severe hearing loss. So, by expanding on the earlier slide, auditory rehabilitation encompasses the following. First is the case history. So that's just the patient story. And it consists of usually an audiologist will look at the information and they'll interview the client to expand on the paperwork that they received. and to get a better understanding of why the client is there. And not all practices, but a certain number of audiology practices have questionnaires, and they're called hearing handy questionnaires, which means like providing questionnaire, be it for different listening settings, different listening situations, and the social emotional reactions to see how much the hearing loss was handicapping those individuals in everyday life. So again, as I said, it's the examine client's listening, communication difficulties, and their social emotional reactions. Secondly, again, I don't know what percentage of practices. It's not enough to know if a person says, I have difficulty in this situation or not so much in that. That doesn't tell us what are the listening situations that the client really want to address in their life. Is it to hear their grandchildren better? Is it better to make it easier to communicate with their spouse? Is it that they want to hear better at work? So what are the needs that the client identifies as being important? So usually this questionnaire is open-ended and we ask the individual, tell us what's 3 to 5 most important communication priorities that you would like to address, because that is going to be the ultimate goal for the audiologist. We want to hopefully move where you have some difficulty to after working with you that you indicate now you're here doing much better than before you started working with the audiologist. And so after the case history, we then do a hearing test. And then after the hearing test, the audiologist and the client and perhaps the spouse, or if the child, the parent, are all in the room, and the audiologist and the client review the findings together. And if there is a hearing loss, based on what the hearing loss shows, based on what the person's lifestyle is, what listening situation they have difficulty, and what they're hoping to address, they come up, the audiologist will recommend intervention that will best meet the needs of the client. And it'll be based on on the hearing loss and hearing performance in quiet and in noise. And most importantly, the listening difficulties and handicap questionnaires, and again, the most important being the listening communication goals on the COSI. Uh, um, that's a client-oriented scale of intervention, as long as they are realistic expectations. If someone is severely hard of hearing and they indicate on this COSI, oh, I would like to hear normally again, the answer is that's not realistic. We cannot restore normal hearing. And so we would like to share that. So as long as it's an expectation of a client that we can realistically address, and then that's what we're going to try to work on, or give a better perspective as to what we can do to help the person on their journey. And also, any issue that may have been brought up during the client interview, we're going to talk about that during this audiological counseling after the hearing test. And then, if the person has sufficient hearing loss, then we're going to recommend, and the client feels, yes, I would like to benefit from devices. Then we're going to fit and program hearing devices, be hearing aids or cochlear implant. And we may also recommend accessories to the hearing aid or the implant, because the hearing aid or implant can't do everything related to hearing, especially in certain difficult listening settings. So we may recommend assistive listening devices as well. We will talk about communication strategies and environmental modification, and we're going to be talking about that in the today's presentation. And we may also give recommendations for auditory training and speech reading enhancement. And here's just a book by Nancy Ty Murray, is one of the leading professionals in the area of oral rehab, and you can see she already has written 6 books on this topic. And she developed a whole program software under a grant that addressed uh, auditory training, speech reading, communication enhancement, etc. So I just wanted you to know about that. And here are these little photos. Here, the first part is showing what is part of AR. Well, here's the hearing testing being done. And then the other photo shows someone receiving counseling in the use of her hearing aids. And the last one is a group type of activity where individuals may be learning strategies and role playing, etc. So, what is the goal? I said early on that oral rehabilitation is a person centered approach. And so it's not the hearing aid that's the focus, it's the person, the client is the focus. And the goal is not to necessarily enhance hearing, it should be enhancing communication. And so, as we said, specifically, we want to address each individual's own specific listening needs. So, for example, I'm going to pretend that the two individuals I'm going to talk to have the same identical hearing loss. Now, one individual, the senior, might be 75 years old or 80 years old, living alone, does not go out very often. Basically, oh, I need someone else to get muted. Someone need to mute themselves. I'm getting distracted. Okay, thank you. Okay, so the senior lives alone, doesn't go out very often. And the most important thing for them is they watch television or talk on their phone to a loved one who may call in and talk to them. On the other hand, you might, again, another person who might have the same exact hearing loss, but this person is very active. They're working. As part of their work, they have many meetings during the week. And this person loves to go out, go to social gatherings, restaurants, bowling alleys, sporting events, where there's a lot of people and a lot of noise. So the hearing loss is the same, but the recommendations are going to be very different. I will share that for me, I'm going to recommend a much higher level of technology for the active adult because we're going to have hearing aids, for example, that can address the noise in the environment and the ability to allow them to focus on what they want to listen and to block out other aspects. And so it's going to be having to have many more features for them hearing aid. But someone who lives alone and doesn't go out very often, the hearing aid can be pretty basic. Just amplify and address the hearing loss. And so, why am I going to recommend hearing aids that are going to cost maybe 6,000 or 7,000? When I can recommend hearing aids that are 1,800 or 2,000. So, what you're trying to illustrate is the listening communication are very different and require different solutions. And even more importantly, hearing loss is the lifestyle, the most important factor when I would or other audiologists attend on a solution, decide a solution that will address that individual's listening needs the best. So now we've talked about what oral rehabilitation is, the focus of it, how it may vary as a function of the their needs. And so now we'll talk about the hearing-related technology because that's part of oral rehab. So beyond fitting hearing devices, oral rehab may also include recommending assistive listening devices. So we're not going to talk about hearing aids today, but we'll talk about other aspects of AR. So one of them, again, so what are assistive listening devices? There's different categories of that. One are remote microphones. And let me see if I can, where I put mine here. Oh, let me just show you mine. This is a remote microphone. It's more than that, but each hearing aid manufacturer produces a mini mic, a very small microphone that someone can clip on and wear, or you can place on a lectern. And what it allows to happen is you, uh, I can go sit in an audience, maybe be 40, 35, 40 feet away from the presenter, and I'll hear them as if they're talking right into my ear. It allows me to hear soft voices or noise settings, or I can, for example, if I'm driving in a car and someone's behind me, they can wear the microphone, I'll hear them in my ears. So, because otherwise the engine noise makes it very hard for me to hear someone in the back seat. So that's an example of an assistive listening device. There are TV adapters, which I started to use last year, and I love it so much, even though I had the adapter for 3 years and hadn't used it. I can plug the adapter into a little box, and then from the television, it sends the signal right to my hearing aid, and I can turn off the volume. No one else can hear it, and I'll hear it at a comfortable listening level. And so, for example, let's say you have a spouse, you can lie in bed, listen to the TV, wear your hearing aid, and your partner won't even hear a sound. Or when you get together in the living room, you have the family, and in the old day, they would say, "You're playing the TV so loud." Now they're saying, "Grandma, you're playing the TV too soft. I can't hear anything." So the exact opposite. I'm using a computer adapter, so I plug in what's called a dongle, USB dongle. It's a little device. I can't pull it out because otherwise I'll lose the signal, but it allows me to hear the computer right into my hearing aid directly. And so I'm hearing you terrifically. That's why I actually like Zoom meetings in some ways better. It's easier for me to hear and lip read than in everyday life. So a lot of hard of hearing people did not find the pandemic terrible because they were able to use Zoom to really communicate with others effectively. And then there are what's like called alerting devices. So, for example, I haven't put it on yet and had it for 2 months in there, but I have a combined carbon monoxide smoke detector that can hook up with each other and they flash. And I didn't want to pay the extra. There are devices that I can use to vibrate, but it meant getting an electrician to wire. But you can be alerted. An alerting device now that I have is using the Ring system and my Google Watch. So when somebody comes to the door, I have a video camera. It sends a signal to my phone that sends to my watch, and then my watch vibrates, and I can see the picture. So I can see. So that's now my Google Watch with my Ring system is an alerting device, but it vibrates, so I don't miss anything. So that's these are all examples of assistive devices. Oh, and there we talked about the smartwatch. Now, both the iPhone and the Android phones, if you look, and I'll show you a couple of photos of it, they have what are called accessible options. So first, you can now, for the latest hearing aids with the latest model of cell phone, you can pair a hearing aid directly to a cell phone. So I can talk on the cell phone now. I can put down the cell phone 25 feet away and I'm going to hear what the person's saying. And the person will hear me, even though the phone is 25 feet away, because when I talk, my voice is being picked up on the microphone of my hearing aid. My hearing aid sends a signal to the cell phone and then the cell phone to the other person on the other line. When that person talks, it gets sent to my cell phone and then gets sent to my hearing aid. So that's a wonderful accessible option to make hearing on the phone better. There are also various accessibility features. And I gave a lecture about 2 or 3 weeks ago, and if you guys ever want, I can give a whole lecture on just on the various applications of software that are out there that allow you to, for example, I can watch TV or a movie or on a computer where they have someone talking, and on my cell phone, if I pick it up and they're paired, or if I'm watching a YouTube video on my phone, or I'm listening to someone even talking on my phone, I can set it to where it'll stream the captions. Or I can set it to where if I'm in an environment and someone's talking, I will see closed captions on my phone. And they also have features that allow me to designate certain environmental sounds so I can be alerted to them. So here's example on the Android phone. So settings, sound and vibration. So here's like the caller, the ring, or notifications. I can set the sound to the highest level, so I'll hear a certain tone. I can adapt to what type of vibration, so I can have it on sound. I can have it vibrating, what pattern I want. And similarly on the iPhone, you have settings. So there are a lot of options now included on your phones itself in the settings that can make your lives much easier. So we'll continue on. Also, all the manufacturers have applications and they allow the user you can tailor your hearing aid via the hearing aid app from the manufacturer, whether you want to make the left ear a little louder than the right, even though it's been set, but maybe you found in everyday life it wasn't set the way you want, you can actually adjust it on your cell phone. You might want to raise the overall volume. In certain locations, you might say, oh, I want to boost the high pitches a little more than the lows. So you can adjust the setting even on your cell phone using that manufacturer's app. Almost, I think every manufacturer has what's called a tinnitus relief app. So if you click on that, it'll allow you to either use various different types of sound. So when you're experiencing tinnitus, it can be soothing music or like a background, like a stream or environmental sound to help address the tinnitus. It'll show you how much, like if you're using a rechargeable hearing aid, it'll give you the percentage of how much battery use is left. It'll tell you how much you've been in a noisy environment, a quiet environment, how often you've been talking with other people. It also now, it can also, we talked about social engagement, but there's one manufacturer even includes fall detection with their hearing aid if the person with the hearing aid, they can designate who they want alerted. So if they were to fall, the hearing aid will pick up the rapid falling motion with sensors in the hearing aid, and then it goes to the cell phone, and the cell phone will send a text to maybe a daughter, a cousin, a doctor even, and they'll be notified as to, gee, you've fallen. And so in one case, I heard a good friend of mine, I think it was his grandmother or his mother, I can't remember, and she fell and he got notified. So he went straight to the home and he wasn't even planning to call her and she couldn't get to the phone. She actually broke her hip. So this really helped. And this device is even more accurate than Life Alert. So I just want to let you know that. Also, audiologists can get access to your hearing aid through these apps, so you don't even have to, for some visit, go into, drive to the office. You can be in within your home, make an appointment with the audiologist, and they'll may be able to address your hearing aid without you even having to go to the office. So, and in addition to what the manufacturers have, what the cell phones have, there are also a number of different independent hearing related apps to help address your hearing listening experiences. So we left the hearing aid technology. Now we're going to go to environmental strategies. That's part of AR too, and you don't have to pay money for that. So you have difficulty hearing in noise settings. What typically happens is that people over time, let's say they don't have hearing aids or devices, or they just stop going. So they socially withdraw, they stay home, they try to avoid those type of situations. And in turn, that can have consequences such as depression. Now, to mitigate such a consequence is very important, but some of which can be done without any costs. So you can implement environmental modifications. So one way is have the talker or you be close, so only about 3 to 5 feet away. So make sure that is the distance. I would say about 3 feet, because the closer they are to you, the louder your voice, their voice will be, and it makes it easier to speech read. You can see their face more easily at that distance. Make sure they have good lighting. If it's dark, then move to either turn on light or go to an area where there's more light. If you're at a very noisy party, now, by the way, I'm sure you've been exposed to this before by being assertive and you learn strategies, but so I'm reinforcing this. If you're at a very noisy party and you want to talk with others, go to a part of the room where it's quieter and has better lighting, or if that doesn't help, then just go to a different room to talk where it's quieter. If you go to a restaurant, try to go to one that's fairly quiet. If you can, call ahead to make a reservation if possible, and ask for a table that's far away from the kitchen because that's where you're going to hear a lot of noise as they wash the dishes and make the food. Or ask for it to be in a corner of a restaurant where there's not as many tables, and that tends to be farther away from the kitchen. And if you're lucky when you arrive, ask for a table that only has a few others nearby that are occupied. So when I see a lot of tables and I have options, I don't want to sit where there's like 10 tables because it's convenient for the waitress. I say, look, I would like to sit somewhere away from others so it's quieter, and they'll do that. If it's dark, and I've done this, there are restaurants to make it more romantic or whatever the reason. Then ask for, usually they'll have a glass with a candle, and I'll say, hey, can you give me one? So, because if I can put the candle in the glass there, I can see the other person's face more easily, and I'll speak treat too. And when I'm invited to a wedding or a large gathering that has going to have music, I'll call ahead or email the host or hostess and say, hey, when you do the table arrangement, can you place me at a table with people I know, but can we be at a table far away from where the music is originating? Because I've been places where I just so loud that I just can't hear the people at my own table. Okay, and if you go to a seminar, a religious ceremony, call ahead and ask for a spot to sit up close and the middle portion. And if you can't do that, if they don't allow you, then try to arrive early so that you can get that seating. So now communication strategies, again, I think you probably noticed, so I'll go quickly. But the most important thing to remember is that communication involves at least two people, a talker and a listener, and you can take turns. And the most important one, and say, in order to be an advocate, it's difficult to be an advocate until you have enough confidence. So if you meet someone, you have to have the confidence to be able to tell others you have a hearing loss. You can't advocate for yourself if you're too afraid to let other people know. So it's important as part of my counseling strategies is to try to get the person to accept their hearing loss, not feel it's a stigma, and to be honest with others. And then if you can do that, then you can say, hey, let the other person know what they can do to make it easier for you to hear. Okay, so we talked about that. And if you come to accept your hearing loss and have the confidence to be assertive, then the following will be helpful. Inform the individual of the level or rate he is speaking is adequate. Inform your communication partner if you hear better from one ear than another. I hear much better in my left ear, so I want people to talk on the side of my better ear. And when I'm walking, they're on my left side. When I'm sitting, they're on my left side. So I let people know where to be. Ask them not to cover their mouth because you won't be able to speech read if they do that. Check for your, so if important information is given to you, like by a doctor or a lawyer, you want to check for understanding. Say, I want to make sure what you told me to do or the medication, what they do. So repeat what you think you've heard and then ask the doctor or the talker to not repeat, just to, okay, I know what you said. You told me what you heard. Here's what you missed. And then to restate it or rephrase what you missed. Now, some of these sounds may not be audible when accessible. So one also should engage in speech reading. But the one thing I figured out being hard of hearing, that it not only gives you the speech sounds visible on your lips, but when you speech read, you're focusing on a person's face. And by doing that, all your attention will be on that and actually helps to block out other sounds. So speech reading does two things. It gives you speech sounds you may not hear, but it also helps to reduce the effects of noise because you're not attending to that. So that's why speech reading is so valuable. If you get into a conversation and it's already been going on, then say, hey, can you tell me what the topic is, what you guys are talking about, rather than trying to figure it on the go. Because once you know the topic, a lot of research shows that'll make it easier to, if you don't hear certain words, you can use your knowledge of language and knowledge of topic to fill in what the word might be missing. So to fill in that missing acoustic information, because when you have a hearing loss, you're not going to hear all the sound, even with hearing aids. You have to do what's called top-down processing. That is, you rely on your topic and world knowledge, the meaning of a sentence, to reconstruct what might have been said. And but because you're having to fill in that information, that means you need some more time to figure it out. You're not doing it automatically. So because it takes you a little longer to process information, others need to talk a little more slowly so you can follow and keep up. And by doing so, it gives you the time to fill in that missing information. But it's also why hearing loss can be so exhausting because you have to work harder. You're not catching everything. So you have to do this. So that's why people who are hard of hearing, if they go somewhere for 2 hours a seminar, they're usually exhausted after. And also because you're working so hard just to catch the information, you don't have enough time to actually think about it, to analyze it, and you may not have enough resources to remember what was shared with you. So the easier it is to make out using microphones and strategies, the more you'll be able to process easily and the more you're going to remember what was heard. Okay. So here, I'm not going to go into it because you're going to have the handout and you'll see in the recording. But here are tips for better conversation. Here's do's and don'ts to guide talkers when they speak to you. So now we're going to talk about auditory training. And in the course of my career, I have found that not only individuals with hearing loss consider auditory training and or rehabilitation to be synonymous, so do many audiologists and SOPs. But auditory training is only a component of our rehab. So I don't know how many of you thought when I was going to talk today that I was only going to talk about auditory training. That is only a component of it, very important component, but it's not oral rehab. So it's just there. So for many individuals, auditory training, if you do engage in that, it can help an individual improve their ability to process information more clearly and faster. It may help them process speech somewhat better in noise. And if you get better in these two abilities, you can process more clearly and faster and more accurately, then you won't have to work as hard. It'll make you less tired and you'll remember the information more better. So there's many benefits to auditory training. And as mentioned, the great majority of audiologists do not implement auditory training in their practice because they're not reimbursed by insurance for doing so. So now I say speech and language pathologists are classified as rehabilitationists, and they would be reimbursed if they do auditory training. I'm trying to move something here. Oh, sorry. I moved my caption and now it won't go. So oh, there we go. Okay. I have mine on caption too. I should have eliminated that. So the internet indicates there are a number of local practices. So I looked to see in the Maryland, Virginia area what practices are doing that. And when I went to the website, I found auditory training provided, when it's provided, it's almost always with children. And when it is provided for adults, it seems that in most cases, it's for those who have normal hearing but still have difficulty processing and retaining information. So, from what I've gleaned, the sites that may offer auditory training for adults in person are university programs such as University of Maryland or Gallaudet, where I was a professor. However, I'm not sure if they actually do one-on-one auditory training or if they focus primarily on teaching environmental modifications, communication strategies in groups. And they're possibly, so here are the places, if you're interested possibly in these classes, Gallaudet University, Hearing Speech Center, University of Maryland, and they have a community outreach program. So they have some programs in different senior living communities, I found. Howard University and George Washington. So these are where they might have these group classes. They may offer one-to-one auditory training, but I couldn't tell from looking at the website. So because there's not many practices offering auditory training, and if you're working or your schedule's very busy, you may not be able to go regularly, like once a week, into the practice. So what's been developed are what are called auditory training apps that you can actually download to your cell phone or to your computer. These apps typically include various aspects of auditory processing, and the goal is to enhance different aspects. It may include doing auditory training for improving the ability to maybe hear some speech sounds a little more clearly, easily. And they do the same different, like is Paul and Mal, were they the same or different, for example? Your ability, they want to see, can you improve your perception of words in sentences? And they may start off as short sentences and longer. It may be to improve your ability to hear in background noise or if it's presented quickly. Now, most ink apps, they start off at a baseline and get more difficult. And if you show that you're doing fine or reaching a certain level of accuracy, and I'm going to describe it here. So these software, they want to find out what baseline level should the training begin at. They look for the point where you do fairly well, about 70 to 80% accuracy. Not too easy, but not too difficult. And then once they have the baseline, the presentation, if you show that you can do 70, 80%, then the presentation become more difficult. However, once you achieve 70, 80% new level, it may increase the difficulty level. But if you're struggling and you perform less than 40, 50% that level, then the app will make it easier again until you're able to do that level, and then it'll bring you back up again. So please note that each person is an individual and their abilities may differ from one from another. And it may depend on how much hearing loss they have. Also, it's not just hearing, but it's your brain ability, your cognition. Some people are just able to process information faster, have better memory, their sequencing. So just know that one person may do better, even if they have the same degree of hearing loss, one person may end up doing faster and better and more accurate just because of the higher order processing. Now, before I discuss specific auditory training apps, there's a link here. So when you get this PDF, um, here's an article that talks about what is auditory training, what the evidence shows about auditory training, and what are the factors that underlie improvement when you engage in a program. So all you have to do is click on it, and then you'll be able to read that article. Now, I also looked at a number of apps on the internet, and most of them had ratings of less than 3.5 out of 5. That's pretty poor quality. So not all auditory training apps are the same. So the following are apps that determined to be of high quality. So I'm just going to talk about three. One is called Hear Coach. It's free, and it's from one of the major hearing aid manufacturers called Starkey. But it doesn't matter what hearing aid type you have, you can access that app, and it has a bunch of listening games. It challenges both your cognitive and your auditory sharpness to improve your abilities, and you can track your progress over time. So if you have a cell phone like an Android, you can click on this and it'll tell you how to download Hair Coach. With an iPhone, it'll tell you how to download Hair Coach. So if you're curious to know about that app and do some auditory training, and for free, you can go to there. Heroes is another app that I read about. It has more than 75 games to improve skills. I don't know if it's yet operational or they're still building on it, but it talked about the ability to um, work on sound and auditory memory and background noise, and you could see how much you're improving over time. This is the program that I recommend the most, but this one is not free. There's a monthly fee. I can't remember exactly the amount, like $10 or $11 or something a month, maybe a little more. I should have said A, not little I, but big I, Lace I Pro. And if you click on it, it'll bring you to the website. It had a lot of research, it had numerous activities, different categories and levels. It worked not only improving your listening, but memory and cognitive skills. It's been around and developed it developed 20 years ago or more, and it just keeps on better. It's incorporated artificial intelligence. It also includes not only auditory training, but it'll give you advice, communication strategies, and it continually monitors your performance. So, and we talked about if you succeed, it gets more difficult. If you have difficulty, you bring it back. So it's always looking for that optimal learning zone. Just to let you know, I'll be done in about 5 minutes, and hopefully you'll have time for a few questions. So it's meant to be personalized. What's interesting, I'm going to talk about it. You can train the software on people's voices that are important to you. Like if you have a spouse, a son or a daughter, you can record their voice and then implement it into the software. So here we go. So number one, there are 27 to 30 different topic areas that they ask you to choose what you're interested in. And you can get trivia and all these questions and different topics. So for example, I picked science and health, I picked sports. And in a lesson, there might be 30 items, about 5 items in each of these six favorite areas. And they recommend doing 50 minutes to 20 minutes a day training 5 days a week. And that's what I'm talking about before, personalized voice training. You can train with an artificial intelligence generated voice stimulation of your family members or friends. So if you record a loved one, they're going to adapt that voice into the exercises so that way you can get practice with the voices that are most important to you. So that way, when you talk to them, it'll get easier to hear them because they're the most important to listen to. It also has over 10,000 different real world listening environments, like being in a restaurant, being in a gym, being in a busy street. So it's not just like a shower noise, it's all different types of environment to adapt as you work on it. It also, and again, it'll look at how quickly you give an answer, how accurate are, it gives you feedback, and it also predicts how well you do in real life. I won't go through this because you can go through the PDF. If I had more time, I would. But these are the four main areas of work on: speech and noise, being able to process speech rapidly, being able to listen to one person and block out another talker, and then improving more of your ability to remember information. And it has also exercises to incorporate speech reading into it, lip movement, facial expressions. So it's not just auditory, but also with speech reading as well. And there's also a learn section for tips on environmental optimization, behaviors, and advocacy. So this is just a photo of Lace AI. You pick your lesson, what topics you want, etc. And as I said, there's monthly cost. So if you click on this, it'll give you more information because it'll bring you to the website. Um, this is just to let you know, if you have a cochlear implant, if you know cochlear implant, there are three major manufacturers of cochlear implants. Each one has developed application auditory training app for those who have gotten an implant through the company. I don't know for sure if you got from Med-El, if you couldn't go to Cochlear and do that, or if it's restricted. But I wanted you to know the cochlear implant companies have also developed auditory training apps that can be downloaded for their clients. This is, I think, the last thing I'm going to get into. You talked about speech reading maybe in the future. I want to give you, I did research as part of my doctorate on speech reading. So speech reading is not only looking at the lips, because that's lip reading, but also looking at a talk and facial expression and body language. Visually, the speech sounds cluster in categories. You cannot see every sound that's produced. There are 40 speech sounds in English that you can, if you have normal hearing, that you'll be able to perceive. Visually, many of these speech sounds cannot be discriminated from others. They're in what's called a visemic category. And so here, example, there are vowels like that you might see like ah. You can see the opening. Oo and O are pretty similar. That would be another category. E and A are pretty similar. So five sound, but only three visible categories. And then here are pop button M. If I didn't say anything, they look exactly the same. So for every one of these, the sound without any voicing would look exactly the same. And the one that are produced like the lips or the they're more easier to see than, for example, the K and the H. They're all the way in the back of the throat and you'll never see it. So you will learn about that in speech reading. And because speech reading provides a limited amount to visually differentiate various speech sounds, it's good to also refer to the talker's facial expression, to the question, to the anger. It gives more information. And then, in order to rapidly fill in the missing information, you also have to use as part of speech reading, think about the topic. What are they talking about? Where are you located? And putting all the information. For example, if I said, my mother baked the I could fill it in. I don't even have to hear that last word. I know it's going to be cake. If I had more time, I'd explain to you why I said that, but that's how you're filling it in. So I did research and we trained people of all different abilities. And in speech reading training, if you're a very good speech reader, we can make you excellent. If you're a very, very poor speech reader, I can make you mediocre, but I'll never make you into an excellent speech reader. So the typical goal of speech reading and communication enhancement is to increase awareness of those visemic categories and to work on communication environmental strategies. That's the primary goal of speech reading. So, in summary, oral rehab is a person-centered approach. It can significantly enhance an individual's knowledge, their confidence, the ability to navigate the different environments. There have been significant technological advances to help people. If you're aware of communication strategies, where to sit, where to position, how to have other people know how to talk to you, and use the devices, etc., and modification of the environment, it makes it easier to communicate more easily. And their auditory training now tends to be software-based programs in the comfort of your own home, and it can improve processing speech beyond just getting and being fit with a hearing aid or cochlear implant. And so that is the presentation. And I hope